Hello, this is Group 6 proposal on Housing First, a comprehensive approach to address homelessness with Champagne, Chioma, Brianna, Nadia, Josie, Christopher.
This is our logic model. It's a logic model of the first housing program. Homelessness is a complex, life-threatening problem with over 500,000 people homeless on any given night. Here we highlight what the input or investiture of the program looks like, the outputs, including activities and who the target audience is, their short and medium-term goals, and finally, the intended impact it will be on homelessness.
We are going to take a look into a pressing issue that affects our nation, homelessness. It's more than just a statistic, it's about real people. And as of 2021, over 500,000 individuals in the US find themselves without a home on any given night. The data provided by the National Alliance to End Homelessness sets the stage for our discussion on effective interventions and solutions. We are going to talk about the transformative approach in addressing chronic homelessness. The Housing First intervention, the initiative, is a groundbreaking in its simplicity and effectiveness. It's based on the principle that most fundamental needs of a person experiencing chronic homelessness is stable, permanent housing. What sets the Housing First apart in its approach to providing housing without traditional prerequisites like sobriety or employment. The unconditional support respects the dignity of each individual and addresses the primary need. The Housing First isn't just about providing a roof over one's head, it's about a comprehensive support. Alongside housing, participants receive a full supportive service tailored to their individual needs. These services are designed to help them maintain housing and address health and social needs and integrate more fully into their communities. The outcome evaluation of the Housing First is focused on understanding its long-term impacts and are looking at several keys. How does Housing First affect housing stability for its participants? Does it influence substance use patterns? And how well does it facilitate community integration for those it serves? But the impact of Housing First goes beyond that individual. We are also examining a broader community indicators. How does the intervention affect the overall homelessness rates? What are the impact on property values and crime rates in the area where it's implemented? These broader indicators help us to understand the ripple effects of the Housing First on its communities. The evaluation isn't just a one-time snapshot. We're assessing outcomes on two critical intervals, 12 and 24 months compared to the baseline. The approach allows us to not just see the effects, but more sustainable impacts over time. The findings from this evaluation are vital. There are potential to inform and shape practices and policies around the Housing First on a broader solution to homelessness. By understanding what works, it can be improved and made more informed decisions that take more effective action on our ongoing efforts to end the homelessness.
In creating and designing our overall research design, we decided to go with the mixed methods approach that would allow us to get a more comprehensive picture of the program and its implementation. So we wanted to utilize both quantitative data and qualitative data for both the process evaluation and the outcome evaluation. In the process evaluation, we were looking specifically at fidelity questions. So is the program being delivered as planned? What factors are influencing the program fidelity? And for the process evaluation for quantitative data, we're looking at demographics, which would help us explore the number of participants engaged in the program and identify any variations in participation across settings or different groups. The qualitative data will help us look at quality of implementation, participant satisfaction, and barriers. For the outcome evaluation, the qualitative data will be collected through surveys and in-depth interviews to capture participant perceptions of program implementation, satisfaction, and barriers. The quantitative data is used to measure changes in behavior, knowledge, and attitudes among participants.
Okay, so the evaluation data collection methods. So the process of evaluation. In order to measure the reduction in homelessness, official documents and database will be utilized. For example, the Colorado Symptom Index and the HMIS will be used to measure mental health and substance abuse outcomes. The quantitative measures, participants will be asked open the question to elicit their opinions on the Housing First initiative. Their experience with homelessness in both age, gender, color, ethnicity, educational attainment, current work status, and length of homelessness. The quantitative measures were participants' demographics, living situation, service usage, mental health, drug use, and the overall program certification. The outcomes evaluation. So gathering demographic details from HMIS guarantee that our target group was precisely depicted in our assessment. The Colorado Symptoms Index, a verified measure of mental health symptoms. Using this method, we evaluate the mental health results of participants in the program. Using tools such as HMIS for demographic information and the CSI for results related to mental health. Our analysis incorporated both methods of gathering data to evaluate the outcomes of Housing First initiative in depth. Using both quantitative and qualitative information, we provided a comprehensive understanding of program efficiency while acknowledging the program difficulties.
Sample recruitment for the process evaluation was done through the staff of the agency who implement the program. Secondary data was obtained from local agencies who have already implemented the model to help us figure out things like why did people leave? Was the staff not implementing the program correctly? Primary data that is obtained from the staff is obtained through interviews with the staff at 4 different points throughout the program. Obviously, in the beginning, you figure out what's not working, and then after the first one, after the second one, after the third one, you want to see improvement after trainings for what wasn't working. In regards to the outcome evaluation, the secondary data was obtained through HMIS and through the agency's client information system, and that has information such as income, gender, age. The primary data would be gathered by from the population through systematic sampling, and it will be gathered through interviews and surveys at 3 different points. First, when they come into the program, then at the 12-month mark and at the 24-month mark, we want to ask more in-depth questions, such as, what have you gained from this program thus far? And the interviews will help us obtain more of a larger picture on the individual and see if outside factors have impacted that. At the end of this presentation, you will see the informed consent, interview questions, and survey questions used for this evaluation.
Okay, in the community-based participatory research, through our evaluation, we were able to identify additional needs for housing stability, recognizing that community partners could assist in meeting those needs. In collaboration with these partners, Housing First consumers were assisted with furnishings and household items provided by Welcoming Home and God's Helping Hand Ministries, enhanced care management through Inland Empire Health Plan, Molina, and Riverside County, as well as local school districts providing free and low-cost childcare for Housing First consumers.
Sorry about that. So during the process evaluation, we wanted to make sure that we were also taking into consideration that the people that we are serving have additional barriers. Housing is the first priority, but there are a lot of additional barriers as mentioned previously. So it's important to collaborate with other faith-based organizations to bring awareness to the challenges of homelessness and what those barriers could be. So we wanted to focus really on just making sure that everyone and all the stakeholders and individuals involved, including those in the community, were aware of the importance of the dignity of demonstrating that the understanding of dignity and worth of a person, and empathy and compassion. During the outcome process, these factors are also important because we want to build awareness through empathy and compassion, promote human dignity, and build a sense of belonging within a community for those that are being directly impacted by the program and those who are providing services through some point within the program, whether that be case managers or just community stakeholders and policymakers.
For this evaluation, we used a mixed methods approach with quantitative methods such as samples from comparable programs. We were able to determine that consumers of Housing First maintained a 73% rate of stability compared to the 32% in housing stability in Riverside County. Tenants based on rental assistance programs, reductions in 5150 holds, the emergency services hospitalization, time spent in hospitals, which according to Morris and Kleinman resulted in an average cost to taxpayers of $7,000 per 6.4 days of stay. Our qualitative findings through interviews and surveys demonstrated an improved self-esteem, increased medication compliance, and overall improved the quality of life. Translation of this data demonstrated positive outcomes in the Housing First impact on housing stability, health, employment, and overall cost and effectiveness. All this, including informed consents and surveys, can be found after the reference at the end of the PowerPoint.